So all of our efforts through those avenues to engage families were basically complete failures. Hence, it's wonderful to be in a learning environment because it's okay to have to learn from a failure. And what we are now realizing is that what we really need to be doing is to prepare the various components of the school where these families are naturally showing up and presenting and naming their issues and working through those issues. We have to prepare these places to be as culturally competent as possible to A, receive them well, respond appropriately when the issue is raised, and to know not to specifically address the issues if they're not prepared to do that, but to know how to connect them to a system of care in the community so that they don't have to just run around from place to place. That no matter where they show up in any of these organizations, they can get access to supports that will help them. And then the community partnerships part of these four, because really, I mean, obviously it's happening in schools. Primary health care, but unfortunately the research shows that primary health care is really one of the most seriously lacking in competence in any of these issues, particularly in relationship to gender identity and transgender. I mean, it's appalling just how far behind the primary healthcare providing community is. Social services, particularly those social services that are oriented toward emergency family situations, you know, runaways, CPS, kids who are displaced, you know, by some measures, it's estimated that about 40% of, as much as 40% of the homeless youth population in the United States identifies as LGBTQ. So those organizations who are serving those groups and faith groups, it's critical to have this, to bring issues of faith and religion into this discussion because it is one of the most divisive arenas that keeps us from being able to have conversation together. But again, cutting across these various areas, when we talk about harm reduction or doing no harm, we are finding a different basis for at least a beginning conversation. So then what we've been doing is to identify key allies across Contra Costa County in each of these four categories who are willing to step up and to discuss being part of a community system of care and to have influence on their peers and their connectors and to be willing to be named as being part of an identifiable integrated system of care, which then is, we have a commitment from the 211 Center, Contra Costa County Crisis Center, that they are going to be maintaining a database on this integrated referral network for LGBTQ youth and their families on their website. It'll be posted on their website and updated every 6 months with information. So that it's beginning to create, and we've had, just in the last year, we've identified programs that nobody knew existed, but we've also been able to start a very significant number of efforts. With very little money, I will add, because one of the things I'll talk about in Lessons Learned is that when you invite people to come together and to share resources in a collaborative way, and you give them a way to move forward and to act, it is amazing to me the sharing of resources and the simple willingness and ability to make something happen, whether or not they get funded for it. So these are the positive health outcomes that we really are seeking. And so here's what we've done in the schools. We are forming, and we are forming an inclusive schools coalitions, and there will be more than one in the county. We originally visioned that we might have one. One is not going to be enough. The county is way too diverse, and it really needs to be rooted with local people who have local influence. And so we specifically chose to be an inclusive school coalition, because while we will have a very specific and just a very clear focus on LGBTQ youth, we really believe that the intersections of race, orientation, gender identity, all of it have to be addressed. And that it is about being an inclusive school and addressing all the ways in which various students are marginalized for their various identities. And as those identities are compounded multiply within a particular youth, that puts them at even greater risk. And so that our work really is framed around inclusive schools. So I want to tell you just about some of the strategies that we are working on as ideas. So we've started with the Gay Straight Alliances and have built a partnership there and included them in our conversations to share information about services, to bring community resources to support the work of GSAs. So we're joining in those conversations. The San Ramon Valley High School GSA has taken on the goal of wanting to change the 9th grade health curriculum to include a component on sexual orientation and gender identity. And their goal is that if they do that, then as young people are introduced into high school, they all have an opportunity to at least receive the same information about issues of sexual orientation and gender identity. Now, they have an uphill battle, but that same school district is also the first school district in the county where on April 30th, all of the GSAs in that school district are meeting to hold a forum like this one, and they are expecting 200 people. And as they are able to bring together 200 people, and we can help support that work through our coalition, that's where we can begin to get traction. And so part of the goal is to change that 9th grade health curriculum to incorporate information like that. And then there's a young student in the county who came up with a Facebook page called GSA 680. So she wants to connect all the youth, LGBTQ youth, who are along the 680 interstate, anywhere around there, sharing information about events, things that they can do, and so we're helping her get her legs. A key strategy is about youth leadership and voice, and I want to commend to you the work of James Morehouse Project, which has developed a train the trainer model that prepares LGBTQ students to be able to tell their own stories. And then to make sure that that storytelling model is incorporated in all of our work. Because one of the most transformational things that happens, and I'm sure many of you have experienced it, is that when you hear those stories, it gets someplace deeper inside of you than having an intellectual conversation with someone that you've never met before and may never see again. It has an impact on you. And so this is basically a leadership training for youth that's not just about telling their stories. It equips them with all kinds of information to be able to become advocates for themselves and others. And we're promoting this throughout our work. Cultural competence is a huge issue. Through some of our partners are the Family Acceptance Project and Gender Spectrum, which is based in San Leandro. They have developed an extensive training for school systems and an evaluation process. We have trained over 800 educators in sessions over the course of the past year in Mount Diablo Unified School District. And then other centers who are serving youth have developed their own LGBTQ 101 trainings, and they're offering it in classrooms and being invited in through health centers. And then in several of those places, the school is inviting them to come in and to establish a school-based support group that can be accessed while kids are at school. But it's being provided by a community partner. The same is happening in Rainbow Community Center with Mount Diablo School District, where we're actually exploring, and I'm in the process of writing this MOU right now, that's actually for Rainbow to provide, which is that one LGBTQ specific center in the county, but an MOU for training, protocols for referring students to RCC for clinical services, case management, out-of-school support groups, and inviting them to do an in-school clinical support group. Moving on, there are other partnerships, the Comprehensive Sex Education Network, and another group I failed to mention here, which is the Bay Area Coalition for Health Education. Both are working on the issue of full implementation of comprehensive sex education in the schools in California. And what they have done is that they've changed all of their training to include now a specific component, not just talking about sex education training, but making sure that they're also addressing issues of family acceptance, sexual orientation, and gender identity every time that they present about comprehensive sex ed. And we've built that into a comprehensive network, and this group functions under the Contra Costa County Office of Education. And so we've been able to link to some authority. We have a middle school partnership that we're experimenting with, and it has been quite an experiment. And since I named it, I will commend the principal for where he is today, but it took a very hard-fought 6 months to be able to arrive there. But I will say that ultimately it was the Family Acceptance Project research and the issues around do no harm, where he said, okay, I can get behind this and work with you. And so they had a day of silence observation last week, where 6 months ago the principal didn't even want this discussed in the school. They had a flash mob activity, and they've developed a student-led video project and have produced posters and other kinds of promotional information in the school. There's a variety of other strategies that we're using. I'm in the process of putting together a toolkit of available resources for allies in the school district who want to become part of the Inclusive Schools Coalitions. But if they feel alone, that they can at least go to a website and gain access to links and a variety of things that we know are working in Contra Costa County. We're holding targeted forums. Another partnership that we have is with our Family Coalition in San Francisco, who's working with one of the school districts in our county to implement the Human Rights Campaign's Welcoming Schools curriculum, which is for elementary schools. And they've also agreed to do the assessment, the school assessment. And we have other school districts who are now watching them and interested in possibly doing the same thing. And in the fall, we're going to have a day-long countywide symposium. You've already done that. I'm very impressed. And then advocating for full implementation of California ed policies. Fair Education Act is the one that we've taken on in conjunction with our Family Coalition, along with issues around transgender students, and this is particularly around the simple issue of providing a preferred name option in school databases for transgender students. That as they take on a new identity and a new gender identity, that would be affirmed, and that the name that they have chosen would actually be used out of respect for them by the schools. And this is an enormous issue with enormous resistance, and we've taken it on and we're working hard on it, and we're not going to give up on it, but we've made absolutely no progress in a year trying to get closer to providing that option. So, lessons learned. You have got to expect this to take time. And for most of us, if we are impatient and we know young people are hurting, it's hard to allow the time that it takes. But it takes time to listen, because our impatience drives our inability to really be able to hear one another and to hear and to find common ground. And so that's one of the critical things. The level of partnerships, and this may sound like a strong statement to say that it cannot be done without a paid facilitator. And yet my experience in community partnerships like this, large-scale community partnerships, unless someone is the cheerleader. I always wanted to be a cheerleader, so I get to be. So unless someone is the rah-rah, the cheerleader, the one who says, that is so, they take one little step forward and it's so great and so exciting and they get that feedback. Or they learn that someone, just 5 blocks away is also really passionate about this, and you connect them and they start talking and they start feeling like they can actually do something. So it's partly about the facilitation. It's really mainly just about you need a connector. You need someone who's in that role and is playing that role in order to be able to really build meaningful partnerships. Mutual understanding and agreement, MUA. People, when I do the work on these, people get sick and tired of hearing me talk about MUA. And eventually they learn that MUA means mutual understanding and agreement. Because what happens is, and this is directly related to the difference between consent and commitment. It is not difficult, in many cases, to get consent from people because that's one way they can shut you up and make you go away. And you feel great, but there's zero commitment and everything falls through. Consent is a way of putting a Band-Aid on something and allowing us to believe that we can move forward with something. So it is forging mutual understanding agreement, and what that specifically means is that organizations who decide to work together should take the time to actually develop an MOU that's based on what are our shared values around working together? What are our shared values around how it is that we treat LGBTQ youth and their families? So what are our shared values? Lots of things that we'll never agree on, that's fine. But identify the shared values which are the motivation for working together. And that's hard conversation, but once that's done and codified in an MOU and becomes part of the staff training of new staff who enter that organization, that's where you begin to get traction and begin to see change in partnerships. And then keeping conversations and advocacy work focused on harm reduction, we find is really critical to this. So some action items for you. Create safe space. And in this case, what I mean by safe space is I want to challenge you to create safe space for people who, in your life, for people who don't agree with you. Either direction. How can you listen and engage people in a way that you are creating safe spaces for one another? Because if you don't model safe spaces with one another, and you can't talk about this, what do you think you can accomplish on behalf of the youth in your schools? So creating safe space with one another. Also, very simple ways of creating safe space. In one of our community programs, they were completely accepting and completely open and really very competent, but there was nothing in their building visually that gave young people who came in there any sense that it would be okay to self-identify as lesbian, gay, bisexual, or transgender. And it just happened to be that there was one of our flyers laying on someone's desk, and one of the youth identified because they saw that. So in the simplest of ways, think about ways in your school environments where you can provide, and not just posters in the hallway, but literally within classrooms, what can you do to provide a place and a space where people might feel safe to identify? Now, I want to talk to you just a moment, because I'm out of time, schedule the FAP-RISK screener training. The Family Acceptance Project, based on their research, has developed a risk screening tool for the impact of high rejecting families. That can be, and it's a clinical screening tool that can only be used by clinicians in conjunction with other assessment tools when they're working with youth. But it is a 6-question screener that is amazing. It's based in the research, and it's amazingly accurate in terms of identifying youth who may be at much higher potential at risk for suicide or a suicide attempt, simply based on those 6 questions. And they do training and follow-up. I really would encourage you to consider, as a part of your work moving forward as a community partnership, is to work with community mental health and primary care providers and the clinical staff who work with your schools to potentially bring Caitlin here to do that. It's a 1-day-long training. It's a fabulous training. It has transformed the work of some providers in our county. Find funding for a facilitator, for a cheerleader. You got to give up turf. You got to break down walls. And as I said, you got to work toward mutual understanding and agreement. So as I close, there are 3 words that I want to leave with you, and I want you to take away. One is listen. I think you already know what I mean by that. I've referred to it several times. The other is, so you do a lot of listening. Another word is harm. Do none of it. Voice. Find your voice. Silence. Because we are uncomfortable with each other or because we are uncomfortable with the situation. Silence among the people in this room, and even though it might be easier to talk about it here because we might be thinking we're talking to the choir, but when we go back home, are you going to go back into silence? Find a voice that you can be comfortable speaking with one another, and help youth find their voice. Because until we learn to listen first and then find our voice, we cannot make the kinds of transformative changes that we need to make, and we can't build the kinds of systems of care in our communities that will really transform environments and create much better health outcomes for our youth. And so I leave you with one of my favorite quotes from Dr. Martin Luther King. In the end, we will remember not the words of our enemies, but the silence of our friends. And not just friends, but the silence of those around us that we would have expected to be our advocates, to have our back, to look out for us. So don't be silent. Thank you very much.